Hello, everyone, and thank you for joining us for our monthly series of Katz Conversations. I'm your host, Sharon Zarabi from the Katz Institute for Women's Health, a network of women's health experts who can treat the unique biology of women beyond the bikini body parts. And today we're going to take a deep dive to learn about one of our women's health specialists, Dr. Shirley Hanna from Staten Island University Hospital, who is a breast imager. So welcome, Dr. Hanna. Thank you so much for joining us. Would love to learn a little bit more about your role as a clinician.
Yes, thank you for having me.
Breast health is such an important topic. I think that women don't really think about their breasts until they get a little bit older. When do women need to think about getting mammograms, thinking more about other parts of their biology and anatomy?
That's a great question. I'm really glad you asked that. So women as young as actually 25 should start thinking about their breast health and going to their provider to get a risk assessment at the age of 25. That's how young it should start. Because some women don't even realize that they might be high risk, that they may need to start screening a little bit earlier than what is generally recommended. But overall, for the general average risk population, the age is 40. So every woman should start screening for breast cancer at the age of 40. And that's generally with mammograms done annually. Now, some women may have dense breasts. And if they do have dense breasts, they may be candidates to getting screening ultrasounds in addition to their screening mammograms, also on an annual basis.
Okay, so it sounds like it depends on where you are in your medical history, family history, and age. But this is an important conversation that we should all be having with our doctors.
Right, absolutely. I mean, depending on the patient's genetics or family history, breast density, as I just mentioned, all these factors may play a role in determining their risk and figuring out exactly what type of protocol is required to screen for breast cancer.
Okay, great. So I'd love to know, one of the pressing questions that we have as we interview all of our doctors that are part of the Katz Institute for Women's Health. What do you think is the most rewarding part of your job as a doctor, as a clinician, seeing so many women from different walks of life?
I would say that there are rewarding moments on a regular basis. Honestly, there's not one singular rewarding moment, it is multiple. And when we identify a small breast cancer, small aggressive breast cancer, and we know that we've caught it in time and we've saved a life, that is, it's really such a wonderful feeling. In addition to, for example, doing a biopsy and putting a patient's anxiety at ease and making it as easy as possible for them so that they're laughing and smiling when they exit the facility as opposed to crying and just anxiety ridden. So even moments like that are really actually quite rewarding.
Mm-hmm. So it's almost like I always say every doctor almost plays part therapist because you're sharing news with a patient of yours. And as you just said, there's the anxiety factor of it. They're not sure what, they're going to hear from you. So part of that psychological well-being, how do you manage your psychological wellness, considering there are times where you may need to share news that may not be the best or what your patient was expecting to hear? How do you go home and how do you take care of yourself when you need to juggle all of that in an office?
So I'll be honest, sometimes there's a case that is really just heart-wrenching, a young patient with small children, a very bad type of cancer. And I do sometimes take that home and we're human, and sometimes there are tears involved or there is just extra thoughts or emotions that are involved even when I go home. And that does play a role in my emotional well-being. It plays a role in burnout too, because sometimes I just can't stop thinking about those patients who may have a struggle in the future after they've seen me. So it is difficult, very difficult. And, people talk about desensitization. Once you've seen several patients, it doesn't get to you as much, but I still feel that when we take care of women like this, I can relate to them so much. it's just really hard sometimes. And there is no perfect answer. Sometimes I do take it home, but I try to really just put the patient at ease as best as I can. And it helps put me at ease too. Just answering all their questions, helping them each step of the way, and being there for them. It really just does help them even in the worst situations.
And do you have any routine that when you come home, I mean, is it exercise? Is it meditation? Is it baking?
So I exercise in the mornings.
Okay.
That's my time. So I wake up very, very early and I exercise. And I find that when I don't do that, I definitely have more of a struggle throughout the day. When I come home from work, it's really eaten up by my children and their activities. So I'm cooking and driving them to soccer and doing all these other things. So it's really difficult to have some me time after work, except right before bedtime. But really, I need those mornings so that I can decompress and start my day off right.
Okay, so you are real. There's the stressors of being a mom and then driving the kids around and tending to them after your workday. So I think so many women, struggle with this, and that's why they're seeking an expert who actually understands them because you're going through the same thing in your own home.
Yes, absolutely. I mean, it is tough. I mean, it's tough for everyone. It is really, the struggle is real. But we just do the best that we can. Nobody's perfect, and we just do the best we can. We got to accept sometimes that we're not going to do it all, and we're not going to get to every single thing, and we're not going to check off every single box in our to-do list, but we just do the best that we can. We can only do what we can do.
Yeah, no, I think we can all relate to that. So words of wisdom from Dr. Hanna. So if you weren't going to be a doctor, what other careers would you have pursued, or what are your interests or hobbies that you would have actually, were your calling or are your calling?
I love cooking. So maybe I would have been a chef. I would love to do it, take some time and just cook and take my time with fresh ingredients and nice fresh food. So I may have explored that route, but honestly, being in the professional medical world was kind of drilled into my head when I was little. My parents were immigrants, and there were only very few career choices that I was given as a kid. Doctor, dentist,
Doctor, lawyer.
engineer, and that was it. So I didn't even really consider many other specialties and fields. And it's hard to think about being something else at this point. I think I really do take great pleasure in taking care of other people and doing whatever I can do to help them. I think that really was my calling. So I do, love to cook. I love to read. I love to travel, but I really think helping people was my calling.
Okay, yeah, and you're definitely doing that in the imaging space. But what actually, I mean, there's so many different specialties. I mean, here at Katz, we have over 26 different departments that our clinicians are a part of. What would you say attracted you most to breast imaging?
I personally have a very strong family history of breast cancer, and I think that played a huge role in what I decided to do with my life. My mom and grandma and all these people. So it was a huge influence on me in my thinking. And I really love taking care of women. As I said, I relate to the struggles of a woman and all the feeling of responsibility and all these obligations that we have. So I really feel that both family history and just being able to relate to patients were really probably my top two motivators for choosing breast imaging.
Yeah, I love that. I feel like anyone who takes something personally into heart and they're not just in it for like the fame or the fortune, it's so much more of a connection that you build with the patients that come through your practice. So that's beautiful. So now that we learned a little bit about, we got serious, we're going to make it a little fun. We usually do a rapid fire with a bunch of questions that we just, spit at you, and you just think of the first thing that comes to mind. There's no right answer, and nobody's judging you. But just because you said that, you exercise in the morning, are you more of a cardio person or a strength training person, or is there any specific type of workout that you tend to?
So I try to get my steps in because, once we hit a certain age, it's really important to keep up our muscle mass. So I do the cardio. I do treadmill. I usually run, and then I do Pilates. So combo.
Awesome. All right, good balance. You mentioned that if you didn't pursue a career in medicine, you probably would have taken the food route. So what is your favorite dish?
To prepare or to eat?
You know what? I'll ask both. First to prepare, because I'm sure what you like to prepare is just something quick and easy.
Yeah, it's really hard. I'm catering to three little monsters here, so it's what do I like to prepare other than mac and cheese? No, I'm just joking. So I usually do like chicken, steak, salmon, anything to get their proteins in, and anything that gives them a variety of vegetables and protein. I guess that's what I usually prepare. Do I like to prepare? Yeah, I actually get enjoyment out of preparing good, delicious, and nutritious food.
And favorite
for me
dish?
personally, I go the opposite route. I like ramen. I like I like Japanese food is one of my top choices.
Yeah, you got me on
I
that
can't
side
be
too.
living in Staten Island without loving Italian food. So I would say those are my top two for sure.
Okay, awesome. So are you a dessert person, sweet or salty?
Definitely salty.
Okay.
Definitely take a bag of chips over any sort of pastry. But I do like the chocolates too. I'm not going to lie. I gotta indulge myself a little bit.
As we all do. And favorite vacation spot?
Oh boy. I would say Greece. That's probably because it's so beautiful and so also delicious. The food is just unbelievable. It was an amazing vacation that I'll never forget. I wish I could go back.
Yeah, Greece, actually, one of the Greek islands is part of the blue zones, which is where people live the longest and have
Yes,
the best quality of life. So good choice.
yes.
And favorite TV show, if you ever have time for that.
Whoa, TV. Okay. So, what I watch nowadays is a lot of Netflix documentaries. I'm really into those lately, which, for better or for worse, it's all serious usually, but I'm really into the true crime and the documentaries. Not to say that I don't love a little fluff, like
Yep.
Emily in Paris. I'm all about that, and Bridgerton. So, really, just anything that'll keep me going on the treadmill is what I tend to watch.
All right. It definitely probably makes the workout go a little quicker too,
You
I'm
got
sure.
it.
Okay. Well, this is so much fun. I love learning about all of the incredible physicians that we have that are part of our institute. So thank you so much for your time. And thank you to all of our viewers. We'll see you next month.